Hello everyone, I'm Laura. What happens if you go a long time without ejaculating? This is a very common question among many men, whether it can actually affect their sexual health. Could ejaculatory abstinence be harmful? Stay with me until the end of this video, and I'll explain what this can lead to. This is a long-standing controversy within the scientific community. Some studies have reported a correlation between the number of ejaculations and its potential impact on health. One of the largest studies ever conducted on this topic was carried out by Harvard University and published in 2016 in the European Urology Journal. This study, a retrospective analysis using patient database records, compared men who ejaculated 21 times per month to those who ejaculated less frequently, between 4 and 7 times per month. It found that men who ejaculated more had a lower risk, around 20 to 30%, of developing prostate cancer. But does that really make sense? Some important points need to be considered in light of this. First, the study design. As I mentioned, it's a retrospective study, an analysis looking backward using existing data. This type of study does not provide strong scientific evidence, mainly because it is more susceptible to bias. It can include memory bias, selection bias, and other confounding factors. In the medical community, we consider strong levels of evidence to come from well-designed prospective studies, those that follow a population over time, and especially from randomized clinical trials that compare different groups over a long period to assess specific outcomes. Therefore, although retrospective studies can raise important hypotheses, they don't allow us to draw definitive conclusions. But what actually happens to men who go a long time without ejaculating? Our bodies are incredibly well designed. There are several mechanisms to eliminate the fluids, substances, and sperm that are produced but not voluntarily released. One of these mechanisms is nocturnal emission, the involuntary release of semen during sleep, which is not associated with sexual stimulation. Other situations, such as congestion or epididymal hypertension, the discomfort some men feel in the scrotal area during periods of sexual arousal, commonly referred to as blue balls, are not harmful and do not cause any damage to health. The male sexual and reproductive system is highly adaptable and finds other ways to adjust to the absence of voluntary ejaculations. The very production of sperm and seminal fluid, when neither voluntarily nor involuntarily released, can be recycled. A process known as apoptosis, cell death, occurs along with reabsorption, which stimulates the formation of new cells and the production of substances that recycle the fluid locally. Therefore, there are no major studies that can conclusively state that prolonged periods without ejaculation or extended abstinence cause harm to either sexual or reproductive health. This issue is primarily related to psychological factors and the patient's overall well-being. Patients who choose to maintain a higher frequency of sexual activity and place significant importance on the number of sexual encounters or ejaculations may, indeed, experience psychological distress that impacts their sexual lives. However, clinically speaking, there is no proven association between abstinence and physical diseases, neither in terms of prevention nor causation. Now, if you feel like your sexual energy isn't what it used to be, or that your desire, firmness, or performance has changed, there's a bizarre, all-natural 7-second remedy that is transforming the lives of thousands of men, and could completely reverse these symptoms. It's 100% natural, with no side effects, no need for risky medications or medical interventions. If you want to learn more, simply point your phone's camera at the QR code on the screen or click the pinned comment to watch the full video that explains everything. And now, moving on, another situation that differs from ejaculatory abstinence is penile disuse. In fact, I have a video here on the channel that is one of the most controversial. It raises many questions about the possibility of penile atrophy or shrinkage over time. Penile disuse can, indeed, lead to restriction and penile atrophy over many years. However, this can be prevented. It doesn't necessarily require frequent masturbation or sexual intercourse. There are, for instance, pelvic floor exercises, and pelvic floor physiotherapy, which can also help improve local oxygenation and blood flow, thereby avoiding this kind of issue. If you found this video helpful, share this information so others can benefit from it too. Send the video link to your family group, to your spouse, or your partner. And don't forget to subscribe to our channel and turn on notifications to stay up to date with our weekly content. Take care and see you soon.